Okay, I guess everybody got quiet, so I guess we're going to start now. All right. So I'm Connie Conklin. I'm the Executive Director of Livingston County Community Mental Health. And before we get started, before we get started on the evening program, we would like to invite representatives from Congresswoman Alyssa Slotkin's office to present two of our artists who were selected from all of the state entries as the winners. So there were only 12 winners across the state and 2 were from Livingston County. So we're very proud of that. So if Austin Blake and Danielle Garber could come up.
I'm Katie Michalski. I'm the Livingston County Field Representative for Congresswoman Alyssa Slotkin. She sends her regards. She wasn't able to be here tonight, but she did provide certificates for Austin and Danielle. And we just want to recognize their tremendous efforts in putting beauty into the world and showing that when we see the ability in everyone, there is no limitation. On behalf of Congresswoman Alyssa Slotkin, she would like to recognize you for your outstanding service to the community through art. Congresswoman Alyssa Slotkin, she'd like to recognize you for your outstanding artwork and your contribution to tonight.
Thank you. And if you guys want to get some pictures, because I'm sure you might want to get some pictures. So. Yep. Thank you. Thank you very much. Very, very amazing work. We also had several other submissions from Livingston County. And so I want to take a moment to have any artists who submitted anything, please stand up at this time so you can be recognized as well. So I think we have some artists. Yeah. Wave your hands. Be seen. Good job, Anna. Good job. You did a great job. Good job. You want a picture? Just me, though. It's just me, Anna. Good job. All right. Okay, now I'm going to turn this over to Holly from the library.
You guys are going to make me feel good. I just want to thank everyone for coming tonight. This is an awesome turnout to really celebrate some amazing artwork. I'm Holly Ward Lamb. I am the director at the Howell Carnegie District Library. And the first thing I'm going to do is the housekeeping. If you have not discovered, there are 2 restrooms down the back hallway, one on either side, unisex, doesn't matter which direction you turn. The other thing is the library actually closes at 7. The program will run past 7. Not a problem. We're all just going to exit through the back doors. We'll point you in the right direction at the right time. A little bit more about tonight's event. I was absolutely thrilled when I got the phone call from Amy asking if we would like to partner with them and host this artwork. And as we're talking, it just kind of kept growing, because if you're going to do this, you need to do something more than just one program about the artwork, which then turned into the panel discussion tonight. Thank you, panelists. And there are 2 other programs, so now you're getting my sales pitch. We will be doing a special director's choice book discussion on the book. Maybe you should talk to someone. Absolutely fabulous if you haven't read it. Fast, easy read, not too technical jargony. It's got me thinking a lot about a lot of different topics. This book discussion is Thursday, March 23rd. The other thing that we will be doing, because this is all about art and its importance and its help in supporting our mental health, we will be doing a program called Adventures in Origami with David Lara. He's got a bunch of his amazing papercraft work on display in our display case down out in the kids area. That program is Wednesday, March 29th. That one starts at 6 as well. Both of them require registration. So this is where I plug our website, howelllibrary.org. Yes, there are 3 L's in a row. And you can also follow our Facebook page. On that note, I'm going to turn it over to Amy. Thanks again for coming, everyone.
Okay, I don't use the microphone very often, so someone give me the signal if something's not working. But I want to definitely thank the library and thank Holly for having us. I want to thank all the artists for putting your amazing art into the world, and we're really hoping to grow this partnership with the library. And so if you know other artists who are interested, just let us know. In keeping with this art, we really just wanted to, we're getting the word out about how powerful art is as a tool for all of us in our mental health. And, art is one of many things that we can all do to take care of ourselves. And so each of our panelists up here is going to spend a little time talking about resources, tools in the community, other ways that we can take care of ourselves. And then after that, we'll have a little bit of time for questions. I also have a resource table back there, and that has some just general information. And I have my business card. So if there's something that you wanted to talk about or information or questions that you have, I am the customer service coordinator at Livingston County CMH. So I pretty much tell everybody, go ahead and call me, and I might not have the answer for you, but I'll sure try to help you get the answer as best I can to whatever resource that we might have to help you or your loved one. So with that, I'll turn it over to, I think Connie is going to start our panelists, right? Thank you again for coming. It's wonderful to see you all.
All right, welcome everybody. I am still Connie Conklin. I am still, as far as I know, the executive director of Livingston County Community Mental Health. And like Amy and Holly both have said, we're very appreciative of everybody coming tonight, and very appreciative of Howell Library, who didn't miss a beat and agreeing to partner with us with regard to this. I did want to talk about some statistics that regarding mental health that I think are important. If I can find my notes. No, I can't. Yeah.
Somebody was asking about where the art is. So in case you came in and you didn't see the art, there are some art pieces kind of where the 2 steps come together on that wall if you look up, and then there's some other art pieces on the glass wall along the back. And those will be here throughout the month.
Okay. So some basic facts, and our panelists are also going to, provide additional details, that 1 in 5 Americans suffer from some kind of mental health challenge. 1 in 25 adults live with serious mental health challenges. 1 in 5 children have some serious mental health challenges. And I'll tell you, locally, we have seen an increase of children coming into our agency of 54% just in the last year. And so we know we need to take care of our kids and take care of adults. And just, I think overall, the theme is be supportive of people. Depression is more common than AIDS, cancer, and diabetes combined. So that I think is an important thing. This event is about stigma and kind of busting stigma and seeing all abilities in everybody, and leading with that. And I think that it's really important for us to do that. The tour that has been going from different counties, that's the focus, is really around reducing stigma and finding ways to support people that have mental health challenges. And it's also about celebrating talent and artwork and the gifts that people have, um, despite whatever challenges any of us have. And I think if we went around this room and we talked about, does anybody know anybody or personally have mental health challenges, there's probably not anyone in this room that could. The problem is, or couldn't say that they do. The problem is people aren't always, it's not always welcoming to say those things. And I think that's one of the things is we have to change that conversation around, we all have to be supportive of one another. We don't know people's story. We don't know what they're struggling with. And we just have to be supportive of wherever people are. And the brain is complicated. And, we spend a lot of money and resources on many things, but we don't invest enough in the brain and mental health, and it's all connected. And we really have to focus on it. And we need to do better. We need to do better for our kids. We need to do better for our adults. We need to do better for seniors and everybody. And so I think that really needs to be the focus. And so with that, I am going to turn it over to Wendy Kuntz to talk about children's mental health.
Hello, and thank you for having me here. As Connie said, I work in the children's portion of our community mental health. I work in our children's home-based program. We have a wide continuum of services for children who 0 to 17, and even more recently, we can have the opportunity to serve young people up to the age of 21 and help them transition, hopefully more successfully, into adulthood, with a focus on attending to their mental health challenges that could be problematic into their future. So I'm really proud to work at CMH. I've been here a long time. We have a wide array of intensity of services that we can provide. And Connie talked about how important it is to start and start early and get early intervention and focus on children. And I think the earlier we can identify, support, treat, and continue to help young people understand that they are still whole people, wonderful people when they're struggling, the better they're going to be as they move into adulthood. So we have really experienced a large increase in the request for services. We are getting a lot of children at younger ages with more serious kinds of challenges. I think COVID, as everybody probably knows, has really, as we've come out of it and kids are expected to go back to school after long periods of isolation, we are just having a lot of influx of really young children who have anxiety and depression, a lot of fear about venturing out into the world again. And we have a lot of interventions that are creative, that are evidence-based, which means they have passed the test of time and there's a lot of data behind them that shows that they are successful. And we work really hard as a staff to train and to be able to provide those interventions that we know are effective. We serve a lot of kids in foster care. We're seeing a lot of, again, younger children. And our children's program, we have case management, we have access to psychiatry, we have outpatient type services for lesser intensity needs. We have home-based, which serves the family system and with a focus on the child, but also through the family system. We have wraparound services, we have respite services, we have just a wide bundle of things. So we are really hoping that people can identify and promote the importance of getting early intervention for kids.
Nice job, Wendy. So my name is Nicolette Sheff, and I work for Livingston Educational Service Agency, so LESA. My role is mental health coordinator, and what I do is I help to coordinate a team of mental health specialists, so social workers, licensed psychologists and such. They come into the school and they provide mental health supports, direct service supports for students. Right now, we can work with students from K to 12, 12th grade, and we primarily work with students who are in general ed, so it's not just a special ed. If you know the difference between the two, it's for all students in all settings. So we can support any student regardless of their insurance, regardless of the limitations that some of that they've had in the past. So Michigan Department of Ed is prioritizing mental health, and so they have released lots of funds to support students in the school setting with their mental health. And so one of the priorities is to destigmatize mental health. We have seen, as Wendy mentioned, an increase in students with anxiety and depression. We also serve and support the school districts with more crisis type of intervening as well. So if students are coming to the office or the counseling center who are, severely depressed or, even suicidal at times or homicidal, we will support the teams and the students and the families, help link them in collaboration with community mental health and other agencies that you're going to hear about, Catholic Charities, La Casa, all of the other agencies in the community, to ensure that they're getting what they need, that the family is being supported. And so we're trying to link our school stuff to our community stuff, which is really important across the board. So that's kind of my role in a nutshell. So I guess it's your turn.
Hello, everybody. My name is Matthew Robert Miller. I wanted to thank all my family and friends for being here tonight. To start it out, so I am a visionary artist. I have bipolar as well as anxiety. I first started painting when I was in the Marine Corps in 2012. It was just an outlet for me from all the stress that was going on, with being a 4612 graphics reproduction specialist and whatnot. I just painting is my outlet. I love going to that like Zen mode or that silence of just like there's no thought there. I have always been an artist, from a child. I've always loved art and art classes throughout school and everything. Currently I'm going for my associates in fine arts at Washington Community College. I have a couple classes left. I did get accepted into College for Creative Studies, which I'm gonna go for my bachelor's in advertising design to become a creative director. Thank you. And then on the line is not necessarily right after, but in the future to get my master's in fine arts from Cranbrook Academy of Art, just to be the first one in my family with a master's. Thank you. So yes, my grandma, my grandpa, my mother, my dad's not really in my life, but they have always noticed when things were wrong or when I wasn't taking medication or being compliant with the treatment, because I was always in denial. And it was probably a couple of years ago when there was a situation that happened to where I was like, holy, smokes, I have bipolar and I need to treat myself with medication. I mean, there's been other instances in like just in general that I've just been very not necessarily down, but in like a manic mode to where I've done things that I would not typically normally do while I'm on medication. But yeah, those it's all in the past. I believe everybody lives and learns. Well, not everybody, but a lot of people, learn from their mistakes. Um, so yes, I have so I have 4 paintings in the front here. There's the one right there, this one, that one, and that one. They are for sale. Those first 2, I'm just asking 50 if anyone was interested. This one's very important to me, so that one's 100. This one is 50, and I'm asking 500 for that one. But yeah, in the past couple of weeks, I've been it's been a lot of things have been coming together. I left my job as an assistant manager and a receptionist at Massage Green Spa in Brighton. I started MIG welding again just to make more money for my lifestyle, that, you know, just the bills and just money for whatever, whether it be paint or canvas or anything of that nature. So yeah, I've been selling more paintings to my friends. I did my second commission piece for a friend. He's, you know, trying to get his rap career going, but I painted something for him, and I also took photos for him to do for like his album artwork. My first commission piece though was, if you've ever been to downtown Milford, there is a cafe called Proving Grounds. Back then it was a good morning. I just put good morning in like a turquoise text, and then it had like a purple and an evergreen background on it. But I actually emailed them because they weren't showing it anymore. And I was like, hey, can I please buy that painting back if you guys aren't going to use it? And they were like, no, we actually sold it to a former employee who brought it to Japan with her. So I was like, holy smokes. I was like, okay, that's awesome. So, but yeah, no, art will always be, well, painting will always be, you know, the just for me, you know, and I just thank you for the support and everything and for being here. Once again, I'll just thank my family and friends for coming and, you know, supporting me. And I wish you all a wonderful night. Thank you.
Hello, everybody. My name is Monica Place, and I work at Livingston CMH, and I work in our pandemic support program. And so what I do in our program is I provide services to individuals in Livingston County who are over the age of 18 who have been affected in some way, shape, or form by the pandemic. And so one awesome thing about my position is it's not just for individuals who get CMH services, it's for anybody that's a Livingston County resident that's over the age of 18 who's been affected by the pandemic. One of the things that we do is a art group, and we do it every other Friday, and it's on Zoom. And we do a bunch of different things. We do canvas paintings. We do different beadwork. We've done some dot painting, which it's like mandala patterns. And I try to change it up every so often. Another thing that we do is I do a podcast. And so I do a podcast every few weeks, and I highlight a different mental health topic. And if you guys want more information on that, you can follow our Livingston CMH Facebook page. I post the information for it on there and other events that we have going on. And then another thing that I do is I do a mindfulness group every Monday. And so it's an hour long, and we just practice mindfulness and meditation. And lastly, I'm also a mental health first aid trainer. And so we provide training for people in our county to be more educated on mental health challenges and to kind of break stigma. And part of that training is also looking out for signs and symptoms for maybe a loved one or a neighbor or someone, maybe a coworker who might be having a mental health struggle. And so we're hoping to have a community one here in the next few months, which will be open to community members, which will be advertising on our Facebook. And so I think that's all I have. Thank you.
Hello, my name is John Fury, and I am the clinical director at Livingston County Catholic Charities. And what that means is I supervise our mental health and our substance use disorder counseling programs. I'm actually filling in for our senior resource coordinator, Beth Newman, who had a little surgery. Otherwise, it would have been her up here. And our role tonight was to talk about our senior services. I first wanted to say a couple just very quick things. Number one, I greatly appreciate CMH and the library bringing the artwork here. And I was thinking about coming tonight and what we were going to be doing and talking about. And artwork is an expression of the best of who we are as human beings. And in so many different forms, whether it's print or writing or music or sculpture or painting. It's incredibly powerful. I previously worked at Brighton Center for Recovery for about 15 years. And we had an art therapy program there with a certified art therapist. And she was able to work with people with severe problems, mostly trauma, things like rape and abuse and all those really difficult challenges. And utilizing the artwork was a way to help people express what they couldn't express maybe in words. So I'm just really grateful to see the artwork here, and it's just a great reminder that we all have a lot of work to do. So thanks to CMH and to the library for bringing it. As far as senior services, Catholic Charities is doing a whole bunch of things in our senior services, and so I'll just quickly list a couple of them and then talk about a couple other things real fast. One of our largest programs is called Be Our Guest, which is an adult day program. It's for seniors who have dementia. So it's a huge challenge, of course, dealing with a loved one with dementia. And part of what the day program does is it allows people to stay in their homes. And a fair number of our folks who come, their loved ones who are caring for them have to go to work and earn a living like we all do, but can drop them off at the Be Our Guest program. And it's a day program, Monday through Friday. And they're in a safe, supportive environment. They do all kinds of activities, and they have outside speakers come in and people who do crafts. They provide them a healthy meal for lunch. And so it's just a great, safe place. So that's one of the things that we do. The second thing would be senior resource coordination, and that's what Beth does, the one who can't be here tonight. We have a program where Beth helps connect seniors to services that are in the community. And one other big plug I wanted to make is we're very fortunate in Livingston County. There's a lot of great services that are available. Doesn't mean we don't have gaps. We have gaps. We have problems. I wish there was more resources, but we're very fortunate in this county to have a lot of available resources. So if seniors need help with things like figuring out the Medicare Part D, Medicaid applications assistance, help with figuring out home care, they do tax assistance, they can help seniors with transportation, they can help them apply for home heating credits, the homestead property tax credit, which helps keep people in their homes. A lot of seniors are at risk of losing their homes. So that's an important thing. So that's one of the things that goes on with our senior resource coordinator. So we also have a volunteer caregiver program, and we have vetted volunteers who go in to do home visits for seniors that might be homebound, might be lonely, might just need somebody to talk to. They also can do transportation to medical appointments, other kinds of appointments. So that's another thing that we do. And we have a couple of brand new things which came about as a result of some grants that we obtained. One is called Home Injury Control and one is called Chore. So the home injury control, we have a handyman who will go in and do things like install the bathroom grab bars and safer, the non-stick bath things, any other kind of adaptive kind of things. So it's to prevent seniors from having injuries and to help them stay in their home longer. Handrails, that's another thing. Stair rails going downstairs, those kinds of things. So that's home injury control. And then chore is similar, but it's helping with light chores. You know, my mom stayed in her home until she was 96. And we're very grateful for that. And she had a fall once and she had to crawl from the bathroom to the telephone about 30 feet with a broken hip. And she missed, I don't want to go into too much detail, but she was trying to sit down and she missed. And if we would have had that and she would have had those supports in place, she probably wouldn't have had to go through that. Fortunately, she was okay and rehabbed and got to stay in the home for a lot longer. But that's something else that we do. But the chore program can help seniors with things that might be a little dangerous for them now, like changing light bulbs that might be too difficult to reach, or like cleaning appliances, putting in screens, taking out screens with the change of season. So that's another thing that we do with the seniors. The last thing I wanted to mention was we do provide mental health counseling at Catholic Charities. We do assessments, one-to-one therapy, family counseling, couples counseling. I have a couple of therapists that are certified children's play therapy therapists. So we work with everyone from very young children all the way up through senior citizens. And as part of that also, we do substance use disorder counseling for anybody from like teenager on up. We do a lot of therapy groups and we work really closely with CMH on our substance use work, and with the courthouse, we work with the adult drug court. So that's just some of what we do, but I'll tell you, there's lots of other great agencies in the county that are also providing a lot of services. So there's a couple of brochures in the back. If anybody is interested in any of that senior stuff, you can find out more back there. Okay, thank you.
So, we were just gonna kind of open it up to questions if anyone has any questions, and if not, then I'm just gonna ask them random questions just to see what I can stump them. So, go ahead.
Two questions here. So the first is for your first two ladies. I was wondering if there's a mentorship program put in place into schools where mentors who've maybe been through mental health things or know how to address certain things with coping mechanisms and things like that come into the schools, or if there's any programs like that in place.
So I might defer to Doug Hazley, who's our superintendent of special ed services back there. But as of right now, we don't have a specific program that brings community members in specifically to our mental health programming, mostly because of confidentiality and HIPAA, but for our students. But I don't know. I think that would there's probably I know that some of the districts have programming that supports students. And part of it has to do with substance use or mental health awareness. And those bring in some of our mentors from the community to talk specifically. So I would say it's local to, or it's specific to the local school district, but our LESA program doesn't have something like that. But I know some of our locals do have some programming that bring people in to help support our students and mentor them, or talk about their experiences and things like that. We do have some of those. Yeah, there are some things happening in the schools for that. I don't know if you've heard of Reaching Higher. That's happening in several of our districts. It's like a mentorship program where adults, whether they're staff or community members, are linked to groups of kids to support them. That's just one example, but we do have several programming things happening like that. What about you?
Well, related to community mental health in the children's program, and I think there are some similar programs in the adult services as well, but they're peer service programs, and that is where somebody with lived experience works with a consumer to support them, to instill hope, to use their story to have they're folks who've had mental health challenges of their own, and they've come through it well. and they are inspirational to consumers. Just like I said, they instill hope, and they give them a vision of what can happen if you know, follow your treatment plan, take your medications. So at our children's building, we have youth peer services. So that is somebody, they're 18 to 28, I think 26. So, and we hire folks. We have a couple of opportunities for staff to come on board, 18 to 26, and then they're paired with children consumers who might need those supports to understand the importance of, you know, following their treatment plan and getting out into the world. And then we have parent support partners, and it's the same thing. It's a parent who has a child who has gone through the public mental health system, which sometimes, even though we work really hard to make things easy, there's a lot of navigating and figuring out how to involve systems and collaborate and coordinate. And so parents are assigned or matched with a parent support partner who can talk about what it was like for them when their child went through. And it's all focused on instilling hope and showing that with the right amount of support and adherence to what the treatment team is suggesting you do to be on the right path, that things can have a different or better outcome.
This one's for Matt, and I see all your artwork here, but I just am wondering, throughout the years, what has what has moved you, and what areas have you been able to put your artwork out into the public aside from like tonight's event?
Okay, so let me think here. So the first question you asked though was like around certain things. So I don't know why, but like ever since I was probably in like, let's say 8th grade throughout high school, um, I always had a thing for like the Eye of Providence. I don't know why I'd sketch it on homework and stuff. But the what brought me into like actually, I guess, getting my artwork out there was I was homeless and I had some friends. I would paint, you know, and they're like, "Oh, well, you should sell your work." I was like, "Okay." You know, I didn't really know how to go about it, but I sold a couple of pieces. My most expensive piece was $190, and that was only in like an 8x12 canvas, and that was while I was homeless. And then I've done tie-dye too, which I still have a lot of powdered dye left, but I've sold a tapestry for that was 190. It was like periwinkle blue. Send you a picture, I think. Yeah. So um yeah, she was a good friend, and she suggested that I sell my work. So I tried to. We go to certain like festivals or events. But it wasn't necessarily the proper way to sell work. I believe there's more of a professional way to go about it, which I'm trying to do like right now from like here on out. You know, getting like I was mentioning this to some of the people I talked to earlier is like Brighton Art Guild. To get involved in that, it's like a $40 membership for like a year, and just like digital prints, you know, things like that. Um, so yeah.
To anyone else who might have youth or little ones or even adults who struggle with coping with mental health issues within their own lives, what recommendations or advice would you give to someone who just doesn't know where to start, basically, or how to get moving on the artistic expression?
So anyone who I honestly deep down inside, I believe everybody has like a creative like source in them. Um, Now, you get a lot of people that are like, oh, I can only draw stick figures, but it's like, well, no, you can go outside of the box and maybe draw like a house or things of that nature. But it's like, my advice for children to adults that are starting or would like to be involved in like art, I would say, I mean, you have like the internet, there's like guided skills, there's classes, you have paint and pour nowadays. You have what else? There's books. So, I if someone came up to me and personally asked me to teach them how to paint or how they could go about painting or even from pottery or tie dyeing, I would probably start off on the basics, like, draw a circle or what's your favorite color? Here, let's put it on a canvas. I mean, and like it's so um, there's a thing with me is like there's a lot of like artwork out there. There's art I appreciate, and then there's art that I don't appreciate. Um, art that I appreciate, it's like more like, I don't know if anyone here has heard of like the visionary artist Alex Gray, but he does great work. Now, to me, I think I like having like bold lines as well as texture to my paintings, but he's more of like a tedious, like getting the exact, like whether it's some type of angle or whatever he's painting. But yeah, I think I'm going a little bit overboard, but yeah, no, I would just basically say, yeah, just read a book, go on the internet, or just buy some canvas and some paint and see what you can do with it. Yeah.
So it was a great overview to hear about mental health services in the community and seeing the continuing of it from, children all the way to seniors. I guess what I'm wondering is what's the greatest unmet need in our county right now when it comes to mental health?
I think specifically related to mental health, what we're seeing specifically in the schools now, obviously in the schools, the focus is academics, but mental health and academics obviously go hand in hand. It's difficult to learn when you're, significantly impacted by anxiety or depression. Um, so I think the increase and the biggest need that we are seeing at the school level is that suicidal ideation. We're seeing a lot of kids who just don't have coping strategies for dealing with the intensity that comes with getting back in the routine of things. And so that is a big, huge need. Suicidal screeners and things like that in our buildings. I mean, we do a lot of work at the secondary level, but we are seeing it, as young as you can think of young, right?
So get close. Okay. I think that for a lot of our families, Livingston County is a very expensive place to live, and we have a lot of families in poverty, and we have a lot of families that are experiencing homelessness. So in addition to everything else that kids have to deal with, they are also dealing with the fact that they could be homeless. And we've seen a huge increase in the number of children who are coming in where that is their circumstance. So there is not an abundance of places that are affordable for families to live. I don't know if anybody else wants to make.
I would concur that the people who are housing insecure or nearly homeless or food insecure, for example, if you don't have anywhere to rest your head, a warm bed to sleep in, it's hard to think, well, I guess I better go get some counseling because I have anxiety or whatever. So it's kind of the whole hierarchy of needs thing. If people have the basics met, food, shelter, clothing, then they might be more likely to or able to focus on something higher level, like seeking help for depression or anxiety or bipolar disorder or whatever. My other comment would be that, you know, where I am, we see the people who have overcome by actually coming and showing up. But my belief is that one of the big things that's going on is that only a fraction of people who need mental health or substance abuse help get it. And I think one of the biggest barriers is stigma. People who are afraid to seek help because they're afraid they're going to be judged in some kind of way. I think that prevents a lot of people from it paralyzes people, and I think it probably prevents a lot of people from seeking help. And that's why programs like this are important and powerful, because every time we talk about it out in the open, it encourages somebody to maybe get past that fear and go ahead and seek help. It was a great question, by the way.
So you,
John's agency has services for substance use, but we need more services for adolescent and younger people to have substance abuse intervention.
yeah, so I mean, I think one of the things that I would say is we have a huge workforce issue around having a lack of direct care from direct care, day-to-day, 24/7 for people that need a lot of support, to social workers. That's kind of our immediate need. I think some of the needs around the way funding is distributed is so categorical and prescriptive that it doesn't allow us the flexibility to meet people's needs. It's provide a unit of service, and people need us to meet their needs, not just provide a service. And so I think those are the things that are kind of the bubbles over our head as we're trying to create programs and services across not just community mental health, but across all of our service system. We're called community mental health, but 90% is federally funded Medicaid health plan. So our ability to serve our community is very limited. And that, I think, is a inherent problem about how we're able to open our doors. We can open them, but not fully. And I think all of our agencies struggle with that regardless, is that we can't grant our way out of this. And that's what we do. We write grants instead of investing in kind of our services and in the people that we serve. We have to go out and try to obtain grants or funding. Here's one-time funding. What happens after that's gone? Then we're pulling the services away. So those kinds of things, I know you probably didn't want me to say all that, but those are the things that I think we struggle with every day that impact the day-to-day lives of the people that we serve. There was a question back there, so I want to make sure I get.
I'm on the staff at the library, and I have a really nice vantage point of the stairwell and the glass wall. And I want to tell all of you how much the people have enjoyed the artwork. I see it every day, people stopping at that landing and looking at that artwork. It is really, really nice. And I think it inspired a lot of people. I mean, I think it will continue to inspire people. So thank you for letting us be part of that. My question is, and this is for all of the agencies, are there restrictions on who can get services at your agency? Someone in the staff lounge today said to me, how does community mental health work? Can anyone just go in there? And I didn't know the answer, and I would like to be able to answer her tomorrow. So I don't know how it works. Are there income restrictions? Are there, you tell me.
Well, hang on a second. I think that one of the things that I was talking about before around the limitations is that, the majority of our funding is Medicaid, which is a health plan. So it's, if you don't have Medicaid, we do have some limits, but we do have other opportunities and grants and different programs where we can serve other people. But we are a safety net provider in our community. So if somebody's in crisis, they can always come to us and we will deal with the crisis. So that part is, we are the safety net that we will intervene in a crisis. Did you want to say something else? Are you sure? Okay. All right. Were there other questions? Oh, okay. Okay.
If we don't have the resource for them, we will do our best to point them in the direction, perhaps based on an insurance they have or things that we know about where what they're requesting can be received outside of CMH.
Hi, I'm one of the artists that was able to exhibit my art on display today, and then I'm really happy that I'm able to be here. And I really wanted to say I appreciate Monica Place. I'm sorry. It's been a pleasure having your art therapy classes available to us, and I really wish that we had more of them, and different ones, and more often, because that really helps.
Thank you. Appreciate it. Is there any other questions? Okay. Well, I saw her. Then I'll go back.
So my question is probably the one that just expresses frustration of the lack of availability. Those with great insurance, you still can't get a hospital bed. You still can't get an appointment till 60 days out with that psychiatrist or the therapy. So there's that. And then we seem very much, we react. So if someone's in crisis, okay, here, we're going to do this, but doing something that's front end so we don't have a crisis. Are there some things that you would like to see the community doing that helps on that front end? Like I know right now senior survivors at Hall High School, their project this year is going to be hounds. So we're getting that whole, every school is going to get a therapy dog in school kind of a thing. That's a small little step, but youth are leading the way on that. So I guess the question is, what would be the dream about recruiting more people in the fields so that we can do that? And how do we do the front work so that our kids aren't having anxiety and depression and suicidal ideation, so that we're not just reacting in crisis, but have something that we've got some of that joy back?
I appreciate your frustration because it's also apparent to mental health professionals when they're sitting with a child and talking to the family that it's pretty difficult to get a hospital bed or to even link them with a therapist that they can talk to in a period of time that's reasonable. So that's a huge concern, I think, across the state right now. But I will encourage that as a parent or a family member, if you do have a school-aged child that is in need of mental health supports, that you reach out to the school-based either counselor, social worker, administrator, because we're starting to create this loop across the county of available therapists for students who do have private insurances. We are communicating where the vacancies are. Unfortunately, some of them still are virtual, which doesn't work great for students, for kids, school-aged kids, but it's something, and we're working to kind of create that communication loop. And we do have, especially at the secondary level, the ability to service or provide direct services for students who are in crisis or who do need, therapy type services, direct services in the schools. And that is not going to be based off insurance or, eligibility, although we are able to bill Medicaid if they are Medicaid eligible. But we can provide support with mental health supports for students, regardless of their insurance in the schools.
Yeah, I think it's a great point, and because we are very reactive, our funding's very reactive. There isn't a lot of prevention funding that exists, which, I hate to say it, but that drives what we can and can't do, and that's not. And I mean, I won't get on my soapbox about we have to invest in kids, and we have to remember that kids are kids and they're not mini adults, despite that they look older. Their brains still are not developed in the same way, and I think overall, regardless of mental health, we need to get back to treating kids like they are kids. And you had a question.
Thank you. Not to get into too much detail, but I just wondered from a general perspective, does community mental health services really vary by county? And just briefly, how are you funded? Or you're funded federally mostly. So maybe they don't vary too much. Anyway, any thoughts?
There is some variance, and I think some of it is we have certain grants that other community mental health agencies don't. So as far as the Medicaid services, they shouldn't vary that much. But as far as other grants, or there's different federal projects right now that we're hoping that they're going to go statewide that are going to expand our door. And I'm not going to give you the acronym because it doesn't really matter, but I think those are things that we really need to invest in those programs that open our doors and allow us to serve our community in the way that we should, and also open the doors for our other agencies that we work with as well. And I mean, I will say on the one good thing about this county that I think is a little bit different, I might be a little partial, but we do talk to each other. We know each other. We have relationships with each other. We don't, if there's a problem, we problem solve it together. And then whoever kind of has that specialty, they take the baton and run with it. And we don't chase them down and say, give me your baton. So I think those are the things that we really try to do. So we try to spread our resources as far as we possibly can. Was there another question? Yes. They're pretty active. Yes. Yes. They have meetings in Brighton at the Methodist Church. They're in the meetings I know are in Brighton. Yes. Yeah. So if you're interested in that information, I can get you that. And it was NAMI is the National Alliance for the Mentally Ill. That's the acronym. I don't necessarily like the word, but yeah, we have a, yep. Yes, we do. Okay. I think we got to wrap this up soon. So I'll take this question and that question.
This is just a quick one. I mean, 988 is a new suicide prevention, mental health, distress. If you're depressed, if you have a crisis number, you can call that and get connected with people. Do you think that advertising and putting that out there more as the 3-digit number, if you need mental health versus physical help, will that help prevent a further something going into more of a serious crisis?
Does anyone else want to take? Yeah, Yeah, I think the more resources we have, I think some of the danger areas is that when we have resources that are very similar, then people are like, do I call 918? Do I call, 211? Do I call 911? Do I call? So I think it's a great resource to have, but I think the other thing is people, when we have too many of the things that look the same, they're not sure which is going to be helpful to them.
So this would be for Monica with the pandemic care program. So is that every county in the state that has this pandemic program for the children? Right, it's just, right, so it's not government funded in any way. Yeah. Okay.
Yeah, so I just wanted to add something from my own personal experience. And I've dealt with mental health things as a young child. I never talked about any of it. I always kept it to myself and tried to push through. And then as an adult, that didn't work anymore. And I had breaking points. So anyone out there who has youth or adult, I would just say checking in with your people. Hey, how you doing today? How are you feeling? What's good? Like, let's try and shift the focus to like what is good, what's light. And if there is some dark, like confront that and talk about it. Yeah, but don't dwell in it for too long. There are a gamut of resources and programs and everything, but like some of you said, there's waiting lists or insurance doesn't come through. So I think just checking in with our people, making sure that they're eating well, that they're thinking good thoughts, that they're doing the things that they enjoy still. Those are really important, I've known for my own individual self. And then as far as helping the community, I knew someone who was carrying around care packages with socks, food, water, good food, not like the processed things that don't really give us good health mentally and physically, but good food, and just helping community out that way, handing out care packages with like socks and food and the needs, basic needs, making sure that those are met. Because like the gentleman on the end here said, once your basic needs are met, you can move out of that survival mode and that hierarchy begins to develop, and you can finally like get into thriving instead of just surviving. So that's all I wanted to add on to that, and just know that there's a community around you always, and it takes a tribe, so it takes a village to raise one and all, and to not forget that you're not alone, and your own mental health is important too. So check in with yourself when you're caring for someone with mental health issues or mental crisis situations. Just know that your health matters too. So that's all I wanted to add on to that. Thank you.
And I think we'll just end on that. I won't try to say anything else. She like and thank you again to the there you are. Thank you. Thank you to all your staff and everybody for this event. It's been great. Appreciate it.
Thank you. Another round of applause for the panelists. Thank you for coming. And there's a lot of food left, and there's like little paper bags if you want to take some home. So there you go. So thank you for coming, and